Okay, good morning and welcome to our webinar on demystifying menopause in the workplace. I'm Wendy Gray, partner at Carter Murray, a global search recruitment consultancy dedicated to marketing and sales and part of the SR Group. I'm joined today by my fellow co-host, Nick Croucher, who is a partner at Fraser Jones, also part of the SR Group and dedicated to finding the perfect job for HR professionals. At Carter Murray and Fraser Jones, we understand the importance of education and freedom at work. We believe every professional should be able to work with autonomy and shape their own career. A major topic of conversation in the workplace, and rightly so, is the menopause. We're hosting this webinar not only to raise awareness, but to help businesses do more to support women through the many stages. So it's my pleasure to introduce two expert guests today. We've got Bernadette Thomas, CEO and founder of Rosby Consulting and the Wellbeing Games. Welcome, Bernadette. And Dr. Francesca Capeluto, NHS GP and founder of the Moseley Menopause Meetup. Also, thank you to everyone for joining us. Today, towards the end of this webinar, we'll invite you to take part in a Q&A via the web chat function. So please feel free to input your questions throughout the webinar. We'll try and answer all of these if we have time. We look forward to hearing your thoughts and questions. I'll now pass over to Bernadette, who will give you the session overview.
Thank you so much, Wendy, and thanks to Fraser Jones and Carter Murray for hosting us on today, which is World Menopause Day. So happy Menopause Day to everybody. Thank you to all of you for joining the webinar today as we celebrate today's special day. I'm Bernadette Thomas, founder of Rosby Consulting and the Wellbeing Games, and we provide partnerships with organisations across the globe to really help them with their menopause strategy and how to support women during this time in their working lives. As we go through today's session, we'll be sharing a lot more information. This is very much an education, insight, and a few tips in there as well. Session for anyone who is going through menopause, but also for you as a business and how you might be able to start supporting women as they go through this transition period. I'm joined by Dr. Francesca Capeluto, and as we go through today's session, she's going to be sharing with us the definition of menopause and perimenopause and what the difference is between the two. We will both be talking about the symptoms of perimenopause and menopause and how they impact on women in the workplace and that manifestation of those symptoms and what might be going on for women. This year's theme for World Menopause Day is actually cognition and mood, and they are two significant symptoms or groups of symptoms that women experience that affect their performance at work. So I think they're really important topics for us to be discussing today as well. So we'll be talking about why menopause at work is a business issue, hopefully demystifying some of the menopause issues for people, and talking to you, sharing a business lens, so what another company has done and how this has helped for them. And then we'll give you some tips and guidance on how to create your own menopause strategy. By the end, as Wendy said, we'll have a Q&A session, so please do put your questions in the chat and we'll come back to those at the end of the session. In the meantime, we will have a couple of polls, so we invite you to all join in those polls and sit back, grab a cuppa and enjoy our talk today. So over to Dr. Fran.
So thank you very much for having me today. As Bernadette mentioned, I'm Dr. Fran. I'm an NHS GP and I have a real passion for menopause. It's something that is not always done very well in the NHS, and I think it's really important that women and men learn about what it is and how you can help those people around you. So first of all, what is the menopause or the perimenopause? So the perimenopause is when women experience symptoms of the menopause, but they're still having their periods. And it's quite a misconception that people believe if you're still having periods that you can't be going through the menopause. Completely untrue. Even some doctors will say this to patients. The first symptom that people experience is actually their periods becoming more irregular, and that's one of the things that women notice first. The average age for the menopause in the UK is 51, but you can start having symptoms up to 10 years before your periods stop. So really women in their early 40s can start to have some of these symptoms, and not even, menopause may not even be on their radar. They've got no idea why they're having this, all these different symptoms. And during the perimenopause is when they're at their most severe. And sadly, there's no fixed time. So we can't tell women, well, you know, if you get through the next 3 years, then you're fine. It varies from person to person. On the next slide, there's a little graph there, which just shows, I think it's a really good way of looking at how things change during the different phases. So at the beginning of the graph, you've got the premenopause. So for those who do have regular periods, this is when that would be happening. And you've got this beautiful, lovely cycle where all the hormones are doing exactly what they're meant to do on a monthly basis. Then you hit the perimenopause and it all just goes a little bit wrong. Everything goes up and down. There's no pattern to it at all. Sometimes women start having symptoms of the menopause, then they get a period where they think, oh, it's over now, I've managed to get through that. But then they can start up again just because it's so irregular during this time. And then postmenopause is when everything sort of settles down again, but obviously with those hormone levels being at a much lower, on a lower scale. Next slide, please. So why is this important? So 75% of women will have at least one symptom of the menopause, and 1 in 4 women will have a debilitating symptom that's related to the menopause. So this is a huge number of women that it's affecting. And I think we don't talk about it enough, and women are suffering in silence. 51% of women said that it affected their sex life and their relationships. Again, huge things. And this can lead on to work issues as well if you're having difficulties at home. And the other thing, again, I think, which can be noticed at work is that women say that they become less outgoing in social situations. So those people that normally would come to the after work drinks or would come to the social events that suddenly start pulling away, they're the people that maybe it's worth giving a little bit extra support to. Next slide, please. So I think we're on to our first poll now. So just as a rough estimate, how many symptoms do people think that there are for the perimenopause and menopause? 12, 20, 40, 100? Just bearing in mind that women pretty much have estrogen receptors from the top of their heads to the tip of their toes. So it really can affect everything. And estrogen is also thought to be involved in about 400 actions in the human body. So very important hormone. So looks like this is a very, very well-informed crowd. So you're right, 53% of our guests felt that 40 symptoms was the correct answer, and that's completely right. So there's at the moment 40 recognized symptoms of the menopause. It seems to be it increases almost every day as we notice new things that we can link to it. So just sort of covering a few of these symptoms. So as I mentioned, irregular periods is one of the first things that women notice, but things that particularly might affect people at work: fatigue, urinary symptoms. If the toilet is not accessible, or you've got to go past lots of people to go to the toilet, and you feel that people might notice that you're getting up from your desk every so often. Hot flush is another one really important in the workplace in terms of what people are wearing and their environment. Headaches, joint and muscle aches, pretty much any. I mean, I see a lot of women, and I've yet to find a symptom that isn't explained by the menopause. So pretty much anything can be included there. Going on to the next slide, I always put mental health as a separate section because really, really important and not often talked about. Again, one's really important in the workplace, so lack of concentration and low confidence. Those people that maybe have been doing the job for 20 years, confident doing presentations, meetings, and then suddenly come to you and say, well, actually, I just don't feel able to do this. and having a bit more understanding, a bit more compassion for why they're feeling that way. Difficulty sleeping. I mean, they use a lack of sleep as a form of torture. We know how one bad night's sleep can affect us. Imagine this is going on for months and months. Can make conditions like ADHD worse. So people who already have an underlying condition, it can become worse during this time period. And one thing that always really shocks me is the fact that 1 in 10 women experience suicidal thoughts. And these are not necessarily women who've had issues with their mental health in the past. And just imagine how scary it must be to suddenly have those thoughts and not have anywhere that you feel that you can go and talk to someone about, where you won't feel judged for those thoughts. Next slide, please. So I just wanted to mention these different groups of people who may be affected by the menopause or perimenopause that you may not necessarily think of. So obviously we think of women in their sort of late 40s, early 50s, 60s going through the menopause, but there are these 2 groups of women. So premature ovarian insufficiency, which is when you have the menopause under the age of 40, and it's actually 1 in 100 women, which is not that uncommon, really. Early menopause, which is when you have the menopause between the ages of 40 to 45. Surgical or chemical menopause, so those women who've had a hysterectomy, had their womb removed for various reasons like endometriosis. Interestingly, different ethnicities go through the menopause at different times. So Black women tend to go through the menopause 2 years earlier than white women. And the average age of the menopause in India is 47. So again, just sort of widening that view of who you feel is should be affected by this. As I mentioned, people with conditions like ADHD can be worse affected during this time. And also there's the transgender community that it's important to think about during this period as well. Next slide, please. This is just a little bit of information about where people can go for support. So GP, obviously quite difficult to get appointments at the moment, but they definitely should be a first port of call. Family and friends, support group. So just people becoming more open to talking about this and sharing their experiences. As it was mentioned in the introduction, I run something called the Molesey Menopause Meetup, which is where I do a sort of information support group once a month, and women come along. And it's just amazing seeing women talking to each other about their symptoms and how it's affecting them. And it's a really lovely space to be in, where people can feel so open to discuss what's affecting them. Just put a couple of websites on there that are very useful for information, a couple of good books. So Jackie Lynch has written 2. One's called Vavavoom, which is about increasing energy levels by changing your diet. And the Happy Menopause is a sort of natural way of dealing with menopausal symptoms. And then obviously in the workplace, occupational health is a great source of information too. And now Bernadette is going to have a chat about how the workplace can do more to support these women.
Thanks, Dr. Fran, and thank you for that amazing insight there. I think that's really helpful for most of us. One of the things I really notice when I'm talking to employers and some of my clients is that a lot of women don't even realize that they're going through perimenopause or menopause. And it's not that they're necessarily in denial, it's just being aware of what the symptoms are. And this is where it becomes more of a workplace issue, because as Dr. Fran said, there are so many women who are going through symptoms. And if you are having a bad night's sleep, or if you've got brain fog, for example, your performance might be suffering, or you as an HR expert or as a leader within the business might be thinking, not sure, whether or not this woman is capable of doing her job anymore. And it's not something that should be judged. And it's really difficult for us to recognize that there are so many symptoms that are impacting on women. And as a woman who has been going through perimenopause for many years, honestly, the number of times I forget the words that I'm trying to get out of my mouth, or forget what someone's name is, And I feel like, oh my goodness, what if I'm going to be judged for that? So please don't judge me today. But there are multiple issues that women are suffering with. And this is where it becomes, when I mentioned before that today's theme is about mood and cognition, it becomes really difficult to continue working when you do suffer with symptoms regularly at work. And if you don't even know what those symptoms are, it feels a bit unexplained. You then start to really doubt yourself, and confidence is not immensely. So I think it's really important that as employer groups, as people within the HR and marketing sphere, that you spread that word as far and wide as possible, not just in your own workplace, but much, much broadly amongst those social communities. So for people to understand, perimenopause is a real thing, and there are so many symptoms that keep coming up for women, and they can be explained through perimenopause. And there is help that people can get as well, but sometimes it's just being aware that can massively help alleviate some of that anxiety. So how some of these symptoms affect women in the workplace. 1 million women in the UK have left their jobs as a result of perimenopause and menopausal symptoms. As I said to you, as someone who has suffered with brain fog, and I continue to forget my words, and it's so embarrassing, and you think there's something wrong with you and you feel like your performance is suffering, there's sometimes no other answer, and you feel like, I must just leave my job, I can't carry on like this. And I've spoken to lots of women who are at SVP level of global organizations who have felt like they just can't carry on because they feel like they're just no good at their job anymore. And it is just a point in time. So remember, don't judge women who are going through this, but equally don't judge yourself if you are experiencing perimenopause and menopausal symptoms. 9 out of 10 women report to be negatively affected at work. And these are statistics from the CIPD and BUPA, as well as the Women's Equality Committee. So these are from 2019 and 2021, these statistics. 99% of the women who were surveyed said that they've described at least one symptom of perimenopause. And a quarter of the women who were polled said that they would consider giving up work as a result of their symptoms. It's really important to note that this is the largest and fastest growing demographic in the workplace, women aged between 45 and 55. So imagine all of that talent and experience and those skills walking out of your door because they feel like they have nothing else to offer. They feel like they can't carry on. They've lost all confidence, or if their performance is being judged as a result of symptoms that is out of their control. And then also, just if you think about the absence level as well, 1 out of 3 women take time off because of symptoms. So these are just some statistics that are impacting on your bottom line as employers. They are also things that something can be done about. So it really is, this is such a huge business issue affecting every single organization, irrespective of your age demographic in your organization or industry. I think it's really important that everyone knows. And even as Dr. Fran mentioned, 38% of partners don't even know how to support their partner who is going through menopause and perimenopause. So the indirect link as well for those people who are supporting their partners who are suffering, they are carrying that burden into work as well. So their performance might start to lack as well in these scenarios. There's another survey that was done more recently, found that 1/5 of menopausal women who were up for a promotion passed on that chance for promotion because they didn't feel like they could actually do the job. So that's quite worrying to think, especially those of you who might have a women's leadership program or some sort of program to promote women within your business. That talent group might just leave because they feel like they can't do it. So the more support you can offer, the better it will be for those individuals. 19% of women who are suffering with menopausal symptoms have reduced their hours at work, and 12% have resigned due to menopausal symptoms. So that's huge. If you think about those numbers just for your organization, that cost to your business is quite significant. So really, really thinking about, and I'll talk about it in a moment, what are some of the things that you might be able to do in your organization to help support more women to remain in the workplace? So there's lots of things that you could be doing. I'm going to just ask another question actually before I share this. But what is in your organization? Sorry, I'm controlling the poll here, so I'm like trying to do 2 things at once, talking. what are some of the things that your organization are currently doing to be menopause supportive? So I'm going to just launch this poll. I'd love to know. No judgment, this is completely anonymous. So what is your organization doing? Are they doing nothing? Are you in the planning phase? Are you just starting your journey? Or do you just have a policy at the moment and active, not just, are you really actively supporting menopause and creating a strategy in your workplace? So I'm seeing the numbers going up. It's really great to see. I'll just give another 30 seconds or not even 30, 20 seconds to get those answers in. So far, there's the majority of you are in the planning phase, which is great. Okay, I'm just going to end the poll and share those results with you. So 40% of you are in the planning phase. That's brilliant. That's excellent to see. And so for those 31% of you, hopefully the next couple of slides will really, really help to showcase some things that you might be able to do in your organization to support, be more menopause supportive. So the COPD conducted a survey to find out what people are actually doing in their workplaces to be more menopause supportive. Really sorry, but I've just realized that my battery is running low on my computer and I haven't plugged in. That was a bit silly. I might be able to get someone to come and help me plug in a minute. But the adjustments that people asked for were flexible working, ability to control temperature, and I'll let you read the rest of them. But essentially, those people that did ask for something to be done are things that were all very, very easy for an organization to put in place. And I'm sure so many of you already have flexible working opportunities in your workplace. You might already have the ability to work from home, to have reduced working hours, to change a job role or to change any duties in your organization. So there are things that you might already have in place at work that you can really do to help women who are going through this without really needing to do much at all. It's very much just about socializing. What do you have already? Thinking about how you can cater to this group of women who are going through menopause and perimenopause. And now I'd just like to share with you what another company have done within their own organization. So this is a London-based business who wanted to create a menopause strategy. And they brought me in to come and help them to look at what could we do, how do we want to approach this. They started by having some things in place, recognizing that they needed a policy. And while they were doing that, they were also gaining the support of their management group. So we had a management workshop. And during the management workshop, we just talked about what are some of the things that you could put in place if people do want adjustments at work? What are some of the things that you might be able to change in the workplace? And they came up with a list of things and prioritized those and said, what can we actually do with this? And what are we prepared to do? So that managers were completely empowered to make a decision if someone did approach them and say, look, I'd like to work from home or I'd like reduced hours. They had the ability to not have to go through another review process or sign off process for this. It was during one of these sessions that they also recognized that we've already got an EAP, so an employee assistance program in place. So we've got access to our GP service. Let's promote that. Let's tell people that this is available for them. They also have access to counselling. This isn't something that we've necessarily spoken about yet, but so many women, I don't have the statistics on this, but so many women present with depression and anxiety during perimenopause and menopause. One of the most common symptoms that nobody talks about is suddenly feeling really anxious about driving, especially at nighttime. And the number of people who, when I say that to them, they're like, oh my gosh, I thought I was like there was something wrong with me. I've never felt anxious about driving. I'm sure some of you are nodding right now. There are so many things that we are not even talking about, but that anxiety around driving, I mean, who would have thought, or just leaving the house. And, you know, on top of that, COVID and having all of the anxiety from COVID is manifesting even greater in women going through perimenopause and menopause. So having the ability to access counsellors via your EAP is really, really important. And cognitive behavioural therapy is one therapy that a lot of people have mentioned that really, really helps them. So back to this company, they said that one of the women, as we were going through this manager training, actually pulled me aside, and she in front of her manager said, I've been really suffering with anxiety and I've had this support, it's brilliant, but listening to this session, and this was a workshop for managers, she said, I'm clearly perimenopausal, I didn't even realize. And she's since gone off and got the support via work, but also had some things that they've been able to put in place to support her and others going through this. And she's now thriving at work, and she feels so much better about staying at work. So it's really important to just think about, this is not a one size fits all. It's not something that is, we've ticked a box and yet we look after menopause in our workplace. Everybody goes through menopause completely differently. And I'll happily admit this, I'm one of 6 girls, and each of us, I'm the youngest, have gone through menopause completely differently. I'm perimenopausal, not menopausal yet, but have gone through it completely differently. So it's really important to understand that we are all very different. As an employer, you need to think very open-mindedly and not have a black and white, this is what we're doing and this is all we're going to do. So I'm going to share with you some of the things that you might start to think about in creating a menopause strategy. And I very much welcome you to look at, what is the deep pain? So for some organizations, this is going to be different than others. And I recognize that particularly in certain industries, that age group isn't such a high proportion of your working population, but you might have people supporting people going through menopause, or you might want to attract more talent in this space. So these might be different for you in terms of the purpose. So think about, what is that deep pain that you're really feeling? And what's the purpose of creating a menopause strategy for your organization? Before you do anything else, what are you trying to achieve? So what's the prize you're trying to gain at the end of it? And what are some of those outcomes you would like to achieve? What can you do, and what is the art of the possible, but what's really going to make a big difference, not only to your bottom line, but also for engagement, for retention, for people feeling like they want to come into work, so performance as well. So some of the things that we would recommend to you are looking at some training and education. So this is going to be very different for different groups of people. So you might have something that is very specific to women as they go through menopause and perimenopause. So what's the training that they need to raise awareness? You might have something that is more about a team. So it might be a team of managers, a team of leaders. How do you manage people going through perimenopause and menopause? What's the right sort of language to use? And you might have something that's more organizational level. Don't forget though, HR and occupational health, they also need some training, because that is an area where people will naturally go to for support. So think about the different types of training and education that you might need in your organization. Then you might have some workshops, and these might be things, again, like a manager workshop, or they might be things such as a leadership workshop, where as leaders you decide what is the art of the possible, what are some of the things that you need to address and that you want to bring in to support people as they go through menopause and perimenopause. Or in fact, it might be for women as they're going through perimenopause and menopause to come together to work out, what do we need? What are some of the things we need to support us? So a top-down and bottom-up approach there. You might also introduce some forums, so women being able to come together to support each other, to talk about what they're going through, and to create the environment to spread the word, to support other people who are supporting others, not just inside of work, but outside of work. Then there's this point around policy, so the formal side of menopause, so creating a policy, creating processes and behavioural changes at an organisational level. Now, policy doesn't have to be a standalone menopause policy. I mentioned before that sometimes you might already have things like working from home. You might have a domestic policy in place already, so it could be just addressing it and acknowledging that we do have something that is more menopause supportive. So you don't necessarily have to recreate any more work for yourselves, but just really identify, where can this sit and what are some of the things that we already do that are menopause supportive. And then we've got some ideas around a menopause network or a cafe, and this is a bit more of a mentoring environment. It's a very relaxed environment, but you allow and enable that opportunity for women to come together to share their stories, a little bit like what Dr. Fran was sharing about with the Molesey Menopause Cafe that she runs. This would be something that's run more inside of work and could be facilitated by someone who's already been through it, so a more senior person within the organisation who can talk to everybody about what they've experienced. And then you might also introduce some coaching. Now, this is very important, and I would say this because I'm a coach, but it is really important for women because everyone does go through it really differently. I've worked with so many very ambitious women who just feel like they can't carry on and they're lacking confidence. They've got so much self-doubt. And it could just be one session to help them to come up with some ideas around, if you are going through brain fog, what are some of the techniques that you could establish that would just sit in your toolbox for if you're presenting to the board, or if you're presenting to a room full of people and you suddenly get a hot flush, or you've got brain fog and you just feel like you can't even talk anymore. So having those things in place can really, really support women to feel like they can carry on and can go through. So coaching is another area that you might also look at. And I've just put up here just some other ideas of some of those workshops, a bit more detail about menopause awareness and support. We've also just established a website where you can access support. So you can access coaches, you can access healthcare professionals, training and education for your organization. So that's the address there. And we are happy to provide that as an intranet for your organization so that you can download resources and have that available to everybody. So whether it be HRT related, whether it be about brain fog, or whether it be about breast cancer and HRT, what are some of those links there? So having that education there, or how do I support someone who's going through perimenopause and menopause, but also some video content so that you can watch things and learn for yourself some of the things that are going on for you. I'm now going to stop talking and hand over to Nick to start our Q&A session.
Brilliant. Thank you very much, Bernadette and Dr. Fran. Really, really interesting kind of insight. Fantastic to have over 400 people on this webinar today, and thank you for everyone answering the polls openly and authentically. So looking at the polls, if my adding up is half decent, we've got 71% of the joiners today who are either in pre-planning stages or at ground zero. Let's start from today. So hopefully these slides have just equipped everybody to go back into their workplace and really kind of build something that's relevant for your organization and an environment as well. So brilliant to have. We've got a load of questions to fire through, and again encourage you to keep on putting onto the Q&A for me to try and read out, and I'll try and tackle as many of these as possible. So let me start with, and I'll kind of direct this to both Dr. Fran and Bernadette. What are the examples of the transgender challenges we should be aware of?
So I would say the main thing there is having a workspace that is open so that people who are going through this difficult journey, which isn't very well supported in the NHS, I think the wait at the moment for the transgender clinic is about 4 years. So it's a very long process. And I think just an open environment where, a bit like with the menopause, where people feel able to discuss what they're going through and don't feel judged by it. As a GP, I'm in no way an expert in transgender medicine, but there are a lot of changes that they go through in terms of hormones and counselling, and I think it's just, as I said, making a space for these people to be able to be themselves and to share the challenges that they're going through. I think with any of these things, that's the important thing, is opening that conversation. I think that's what I would say.
Brilliant, thank you. Next question. Is it correct that menopause is covered in the protected characteristics under employment law? Therefore, is it important companies do have a policy and provide support?
I think it's really important that companies do provide that support for women. I think it's just coming in at the moment, something new coming into the policy. And so for organisations, you really need to have something that is more protective of women as they're going through this period in time. There have been a few case tests situations that have gone in the past few years where it's really been raised to the surface that this is a very live situation. I think menopause has been sort of pushed to the side for such a long time that we need to start doing more around it. I think it will only get worse if you don't have a policy in place. So I do feel like there are going to be more cases that come to the Employment Tribunal as a result of not doing anything about it, or if there are performance issues that are related indirectly or directly to menopause symptoms.
Brilliant. Thank you, Bernadette. What support should we offer for andropause?
So I'll hand this over to Dr. Fran in a minute to explain a little bit more. But just for anyone who doesn't know, andropause is the male menopause, and this is quite different. But again, there's a lot of emerging research into male menopause, and it impacts and manifests in a really different way for men in the workplace. A topic I could talk about for ages. I'll let Dr. Fran talk for a moment about the support that is out there.
I'd say it's probably quite similar to the menopause, but I think not enough is known about it, and that it's a new thing that's coming through. But I think with any of these things, it's just about openness and talking about it. I think it doesn't matter what it is, whether it's transgender, menopause, andropause. It's just allowing staff to feel comfortable to talk about it. But yes, I have to admit, it is not my area of expertise.
There was actually a study done a few years ago on this, which from Ashridge Business School, and they look at the differences of andropause, but testosterone is decreasing over a longer period of time, so the impact is quite different in terms of women. It's a shorter period of time that it's happening, and so the impact is quite sudden for all of those hormonal changes, whereas men, the decrease is far more gradual. But from what I've seen from these studies, and the impact at work is very much around not feeling like you're valued anymore, and not necessarily wanting to go for promotion, or like very similar to what we've been talking about for women as well.
Brilliant. Thank you both. And this is definitely a question from one of our HR participants. So as an organisation, they have a global presence. What do you recommend outside of the UK for menopause support, both health networks and also within their own company?
So I'll let Dr. Fran talk about the health networks, because I suspect she'll have a bit more information. But certainly within their own companies, whilst it may not be at the forefront of, depending on the country that we're talking about, but certainly the work that I've been doing in Asia Pac, there's a lot of organizations that are saying, you know what, we need to get ahead of this. This is something that, whilst it might not be on the political agenda as highly as it is in the UK, it's certainly something we need to be so much more aware of. So I think anything that you're doing in the UK should be matched in other countries, depending on the cultural differences, obviously, but really putting in place those support networks, thinking about what's the training and education you can provide, because the symptoms aren't changing in the different countries. They're just affecting people at work, maybe in a different way.
I think it's, as you said, Bernadette, it's pretty much the same wherever you are. It's having access to the right people. So in a way, it doesn't really matter what the medical setup is. Obviously, here we have the NHS, so you should go through your GP, who can then is the kind of gatekeeper to the specialist services. But even if you're in a country where there isn't an NHS and it's more of a private healthcare, you will still have that sort of person that you can go to it. It just, the access is different. In some countries, you can go directly to a gynecologist who may have a better understanding. Not always the case, because not all gynecologists specialize in menopause care, but I really believe in empowering the patient. So the patient knowing before they go to whichever healthcare professional it is, what they want to get out of that consultation. You know, are you going to see this doctor for information, for advice? Are you going because you know that you want to try HRT or a different medication? I think it's really important that people prepare for their consultation, so that you go in feeling, I know what I want from this, So the person who's there, who's sometimes maybe behind a very large desk, wearing a white coat, looking formidable, as it were, that you don't feel put off by that you're able to say, well, actually, this is how I'm feeling, and this is what I'd like to do about it. So I don't think it matters which healthcare professional you go to see. I think it's a lot about you feeling, knowing yourself and knowing what you're trying to get out of it.
Brilliant, thank you. We've got a lot of questions on the chat around access to slides, etc. We will be putting a follow-up document made available to everyone joining. So just to answer that question, we will of course kind of have a leave behind which will be produced. Dr. Fran, I'm certainly not asking you to be an NHS spokesperson here, but quite a lot of questions from individuals who I guess are finding it hard to navigate the NHS, and at times getting the right support from their kind of local GPs, etc. Are there any kind of hints, tips, workaround suggestions you would suggest to those individuals who maybe don't feel that they're getting the GP support that they need?
Yeah. So first thing is, when you ask for an appointment, ask to speak to a GP who has an interest in women's health. There'll usually be someone, even if it's not their title, as it were, the receptionist will know who is interested in women's health. You can ask for a double appointment, which is 20 minutes rather than 10 minutes. It depends on the GP surgery. Some will let the patient book a double appointment, others it needs to go through the GP. Read. So there's loads and loads of websites, a couple I put on the slides. Read about what the symptoms of the menopause are. Figure out which are the ones that are causing you the most trouble. Do your blood pressure, do your weight before you go to that appointment. We only have 10 minutes, and we might have had a suicidal patient before, then maybe a funny toe, then maybe an 8-week baby check, and suddenly we've got someone who's having menopausal symptoms. It's quite a skill to switch from different parts of your brain to cover all those different areas. And so having a patient come in front of you that goes, well, I've done my menopause symptom questionnaire. These are the things that are bothering me. I've read about HRT and I'd like to try this. What do you think? The GP will go, amazing, thank you. And yeah, here's your prescription if it's appropriate. But there's definitely it is hard. It's hard to get an appointment for anything at the moment. And I think a lot of women feel, because I hear it all the time, well, I thought I'd wait until it gets really, really bad. No, do not wait till it gets really, really bad. When you get those first symptoms, you go and you talk to someone. Because particularly with HRT, we know the earlier you start it, the more benefits it has. And just to end on what I would say is, if you have an appointment and you feel that you don't get what you want, you go back. So never just accept that first consultation. Ask to speak to a different GP. If you've had 1 or 2 consultations and you still feel you're not getting where you need to be, then ask to speak to the practice manager, because there's obviously something that's not fulfilling that patient's need. So yeah, I could talk all day about NHS general practice, but I will stop there.
Thank you, Dr. Fran. I mean, and thank you to everyone who shared kind of their personal challenges in navigating the NHS, and we will try and go through those kind of individual questions and see if we can kind of get some additional kind of points from Dr. Fran after this call and redirect to. But thank you for sharing those. I guess Bernadette, you talked about kind of hybrid working and remote working as a real positive. I guess one of the questions we've got is, with the new way of working, hybrid, how do we reach out? The subject is very personal. As an HR professional, sometimes it's difficult to manage the employees' emotions and to support them fully. So I guess that's one of our kind of participants seeing kind of the remote hybrid working as a challenge and a positive. So any tips there?
Yeah, so as I mentioned, it's definitely not a one size fits all. And one of the things that we recommend you do is a survey, and it can be an anonymous survey, or you might ask people to put their names to it, but asking people what is the support that you might need, even if you are working from home, because sometimes you do have the worst night sweats, and your sleep is really badly interrupted, and you might notice even more so with alcohol, not for me, but you might notice for yourself, you might get sleepless nights, and so you're waking up in the morning, and even if you are working from home, it's still really hard to be present and to be productive. So they are also times when people might feel like they need to be able to say, look, I just need to work a different schedule today, or this is what's happening for me. So the more that you're raising awareness for people that you are a supportive organization, the more that you can share information. And even if it's just creating an intranet site for people to access information so that they can look at it for themselves, or to have short videos for people to access so that they're understanding for themselves, without it being right in their faces all the time. And maybe it's indirectly asking people, if you feel like they're not going to be forthcoming with information, that might be the option for you. One of the things I didn't mention before, which I think is really important to identify, is this can also be a really troublesome time for women if they're grieving the loss of potentially having any more children. So it does need to have some one, compassion around all of it, but also just some understanding and being just being aware that this might be affecting women in a different way to what you might assume. And so just think about how you are talking to people. If it is a survey, then maybe it's anonymous, and ask people, if you were going through perimenopause or menopause, what are some of the things we could do to support you? Or what do you think if we created a menopause strategy, what do you think people would want? So that it's not a direct question of what do you want? So just thinking about the language that you're using there as well.
And to kind of counter the comment around flexible working, one of the questions from the participant is, if you work in an industry that cannot offer flexible working, what else can a company offer in terms of flexibility?
So I think access to rooms that aren't like bright lights, well ventilated rooms, access to just a space that might be a lot quieter. So I don't know, there might be some people, let's say you're in retail, for example, or you might work in a school environment, but having the opportunity to have additional breaks, having a space where you can, if you're having a hot flush, for example, or a cold chill, then you can go into a space that is allows you to regain your body temperature. There's also things like access to more water, more readily available. If you're having to wear a uniform, maybe think about the uniform that you're wearing. If you've got something that's polyester and you sweat a lot because of your symptoms, think about what's the uniform that you might be able to change to or adapt for people. It could be a shift worker. So if you know when you're having sleeplessness, because often it's related to hormone cycles. So if you know when in your cycle you're going to have those sleepless nights, hopefully not all the time, but if you're aware of that and you're keeping track of it, you could be asking for things like change in your shift pattern. So there's lots of things that could be relevant to different industries, and I can't assume for everybody, but if you just think about what are those things that I could potentially ask for, and asking, because the worst that someone can say is no, but then thinking about, well, what's the alternative? What else might there be out there?
I think we've got time for 2 more questions. So apologies for anyone I've missed out. We've got a lot to run through. So kind of second to last question. Do you have any advice on how to ensure men in the workplace are comfortable with the topic and helping their female staff and colleagues?
Well, this is a really tricky one, because I know that there are lots of men who are not comfortable talking about this. And it is about having more senior people in the organization, men in the organization, who advocate and who come out and share their own experiences of supporting someone, or maybe they themselves have gone through andropause, but an ally essentially, and someone who is willing to speak up and say how important this topic is in the workplace. It's about putting things into place. So it's the women who are getting the support that they need, and then having the trickle effect of when we have more people and that snowball effect, more people getting involved in activities, education sessions that are mandatory, perhaps having videos sent out or recordings sent out in your workplace, having it as a live topic of conversation, having guest speakers coming into your organization to talk about it. So whatever it might be, don't be put off by that. And it's about gaining that senior leadership support and being able to speak out about it as much as possible.
Brilliant. And final question, and obviously it's great having you in the room, Bernadette, but how do companies go about finding a qualified menopause coach? Is there an association or a body that you can talk and point people towards?
Yes, so the British Menopause Society is available, obviously. It is just coming, emerging. There are a lot more menopause coaches emerging. Depends what your organization already has in place. You might find that you have a coaching cohort that does offer menopause coaching as well. Certainly, I know of a few different organizations that are much larger coaching bodies, and they do specialize in menopause. And I don't think the ICF or the EMCC yet have it on their website as a qualification per se, but you could try that and check that out. And yeah, the British Medical Society is a great place to go as well.
Brilliant. Thank you both, Dr. Fran and Bernadette, for answering all of those questions. And any questions we've missed, we will, in our write-up, try and capture those and kind of collate as many answers as possible. But I'm going to pass you back over to Wendy for a closing statement. And thanks again for all the questions and answers.
Thanks, Nick. So that wraps up our webinar for today, and what an insightful one it's been. Firstly, a huge thank you to Dr. Fran and Bernadette. Sharing your insights with us has been so inspiring, and your passion for the topics and subjects is going to help women kind of work their way through this uncertain and new time. Thank you for joining me, Nick, as co-host, and thanks to everyone that's joined today. We had over 400 people, which is great news. And as Nick mentioned, if you have any questions or anything we haven't covered, then please don't hesitate to contact us. And thank you again. I hope you found this session as useful as I have.